Given this story isn't about transing kids, white guilt, racism, the evils of Vladimir Putin, I can see why it totally got missed by the CBC, our taxpayer-funded public propagandist. Broadcaster. What was this little story that got overlooked by the CBC? It was a Danish study published last month in the Journal of Pathology, Microbiology, and Immunology, headlined SARS-CoV-2 spike mRNA vaccine sequences circulate in blood up to 28 days after COVID-19 vaccination. Now, you would think, given the CBC's overwhelming commitment to protecting Canadians from coast to coast, they would have simply reported on this from the public health service aspect alone. So why didn't they? Well, maybe because they just didn't want to worry Canadians with more good news. After all, Canadians might simply get so excited, and next thing you know, poof, heart attacks. Specifically, the researchers found, and I quote, "We surprisingly found fragments of COVID-19 vaccine mRNA up to 28 days post-vaccination in blood from chronic HCV patients vaccinated with mRNA vaccines from both Pfizer-BioNTech and Moderna. Yep, safe and effective." This happened quite by chance, one of those lucky things, as the researchers were testing for other RNA related to hepatitis, but the researchers accidentally stumbled across COVID mRNA in patient blood samples as late as 28 days following injection. Now, it's a critical fact that all the study patients were Danish, the reason being that Denmark is one of the few countries that properly followed guidelines to aspirate prior to injection. This prevents accidental injection into the bloodstream, which then rules out the theory that the mRNA got into the bloodstream by improper injection techniques, which were a cause of directly hitting veins. So, what does all of this mean? Well, first off, the startling implication of the study is that the mRNA is making its way into patients' bloodstream in some other way besides injection, which according to the experts wasn't and isn't supposed to be happening. Looks like the mRNA didn't get the memo that it was supposed to stay put at the injection site, at the shoulder. Given the speed of science we've been moving at, I wouldn't be surprised that you may have forgotten what the experts told us later on. That was that the mRNA might also be found in lymph nodes, but not to be alarmed because that was perfectly normal as well. Gotcha. Safe and effective. Totally right. Now, I'm no mRNA expert. I don't know who is, but if the mRNA can get into the bloodstream, doesn't that mean it can go nearly anywhere? Like into the heart, perhaps? I'm thinking that's probably not a good thing, right, experts? Could that have anything to do with all the myocarditis and pericarditis we're seeing lately? Nah. Safe and effective. The next implication is a little bit more worrisome. Once again, the experts told us repeatedly the reason why these new vaccines were so safe was because the mRNA being administered degraded quickly in the blood following injection. We were told that mRNA is a very unstable molecule, and the body quickly eliminated it. So problem solved. Nothing to worry about. But this study confirms the exact opposite. That the mRNA, like your Uncle Earl, didn't leave and was still hanging around a month later. And that was the oldest sample they had, which means it could possibly be there longer. Like totally safe and effective. In fact, we were told that this technology was so cutting edge. Just how cutting edge? Well, each mRNA particle was supposedly coated with a fat, a lipid nanoparticle, LNP capsule, to help it evade the immune system and get into cells where it can start making spike. These LNPs were supposed to be quickly eliminated, and the mRNA at most could only survive for mere minutes on its own, merely suggesting it could be days or weeks, got you automatically labeled a science denier and a spreader of misinformation. Rightly so, right? It certainly looks like the Danish study has brought into question one of the most significant safety claims, that the mRNA quickly disappears from the body. But that's not all. No, there's more good news. It raises a new, more horrifying possibility that somehow the mRNA could be reproducing itself. I mean, it would certainly explain why the mRNA hadn't been already removed by normal body processes 28 days later. Well, beyond what we were originally promised anyways. So recapping, the four horsemen of the apocalypse, big pharma, big government, mainstream media, and medical experts were absolutely 100% clear that there was no way the mRNA could travel beyond the shoulder. And even if it did, on the off chance, say to the lymph nodes, there's no way it could stay in the body for more than a few minutes, and hell no to the, max, that it could ever reproduce. Yes, clearly safe and effective. Lastly, why on God's green earth hasn't this been studied before? I mean, the original clinical trial participants could have easily been tested for mRNA well before the FDA granted emergency use authorization. Why didn't the FDA in the US make Pfizer and Moderna determine how long the mRNA persists in the body? Inquiring minds would have loved to know. And what was the CDC's basis for claiming that it quickly degraded? Now, I've got a few guesses, but I'd certainly love to hear some of yours. Anyway, thanks for watching. I do appreciate it. Please post any comments you have in the comment section. You can always follow me on my Rumble and my Locals account. And if you're on either one of those channels, please subscribe. And this way, you know what? I'll still get to be around and I won't be eliminated or canceled, or maybe this news is just too good for YouTube and they say, nah, we can't have these happy stories anymore. Anyway, thanks for watching and I will see you next time.